has announced the beginning of a clinical trial in Michigan for a potential COVID-19 vaccine. Initial manufacturing for the vaccine will happen at this facility in Portage. The first stage of the trial will involve up to 360 adults in New York, Maryland, and Ohio. This is the third vaccine to be tested in the U.S., and it contains genetic material called messenger RNA, which tells cells what to build. In this case, an antigen that could activate an immune response for the virus. Governor Gretchen Whitmer says the fact that Pfizer's initial manufacturing for the vaccine is in Michigan is great news for those on the front lines and for the state of Michigan. Governor Whitmer said, quote, "Pfizer is a great partner and the state of Michigan and our strong manufacturing roots stand ready to serve." A new tool in the fight against the coronavirus is making its way into hospitals and clinics around Texas. Allie Spilliers has the details.
With a simple finger stick and a couple of drops of blood, a serological test looks a lot like a diabetic's daily glucose check-in, married with an at-home pregnancy test. And soon it could be just as common for the doctors fighting back against COVID-19, like ER Near Me's Gaurav Bohill.
What it really does is it gives us as frontline clinicians the ability to say, I'm sorry, it looks like here's what's going on, combined with your symptoms. This is more than likely the result.
With just 2 drops of blood, he says this test can search for the antibodies present when fighting off COVID-19, and it can do it in just 10 minutes. That's remarkably less than the wait times patients have experienced from labs processing nasal swabs. But with the good,
The fact of the matter is the test isn't perfect.
Comes a downside that can't be ignored. For one, the technology is still being tested, and its results are considered presumptive.
If you have a negative result, it doesn't exclude you from having COVID-19, and a positive test is just a high indicator.
Meaning though he's able to send patients home with some peace of mind, he's still sending off nasal swabs to confirm a positive case. These serological tests also aren't FDA approved, though the agency decided back on March 16th to allow manufacturers to start shipping them to doctors anyway, in an effort to increase testing capacity.
We understand the negatives. We understand there are limitations. But at the end of the day, this is a tool. And if used properly, it can become a powerful tool.
Well, doctors do stress that testing should never replace prevention efforts, adding that everyone plays a role in stopping the spread of the disease. More than a dozen children in New York City are hospitalized with a mysterious illness that may be linked to COVID-19. According to the city's health department, the 15 patients range in age from 2 to 15. The symptoms include a fever and stomach pain, along with features of Kawasaki disease and/or toxic shock syndrome. 5 of these children have had to be put on ventilators. None of them have died. Several tested positive for COVID-19 or tested positive for antibodies.